Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a hematologist talking to a patient called Mr. Romario. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Romario. I'm Dr. Reynolds, and today we'll review your health history and discuss any concerns related to your haemophilia. This is also an opportunity for you to ask any questions. Does that sound good?
Yes, absolutely. Thanks, Doctor.
Great. To start, could you tell me a bit about your medical background?
Sure. I was diagnosed with haemophilia A when I was a child, so I've been living with it all my life. It's moderate, not severe, and I manage it with factor VIII replacement therapy. I don't need treatment every day, only when I have an injury or surgery.
Got it. Have you had any recent injuries or bleeding episodes?
Thankfully, nothing serious in the last year. I had a minor nosebleed about 2 months ago, but it stopped after a few minutes.
That's good to hear. And are there any medications or supplements you're currently taking?
Other than the factor VIII, nothing regularly. I take ibuprofen sometimes for headaches, but I've been told it's not ideal for people with haemophilia.
That's correct. Ibuprofen and other non-steroidal anti-inflammatory drugs, NSAIDs, can increase the risk of bleeding. I'd recommend acetaminophen instead for pain relief.
Okay, I'll make that switch.
Excellent. And what about your lifestyle? Do you engage in physical activities?
I try to stay active. I go for walks, and I do some light stretching and yoga. But I avoid high-impact sports like basketball or anything that could lead to injuries.
That's a very sensible approach. Low-impact activities like walking and yoga are great for maintaining fitness without putting you at risk.
I've also been mindful about my diet. I read somewhere that proper nutrition can help with joint health, which is important for haemophilia patients.
Absolutely. A balanced diet rich in calcium and vitamin D is particularly beneficial for bone and joint health. Maintaining a healthy weight also reduces strain on your joints, which is crucial for preventing complications.
That makes sense. Speaking of joints, I sometimes get stiffness in my knees, especially in the mornings. Is that common?
Yes. Joint issues are a common concern for people with haemophilia, even with good management. Repeated bleeding episodes in the joints can lead to inflammation and stiffness over time, a condition known as haemophilic arthropathy.
Is there anything I can do to prevent that from getting worse?
Regular physiotherapy can help maintain joint mobility and strength. I can refer you to a physical therapist who specializes in haemophilia care. They can create an exercise plan tailored to your needs.
That sounds like a good idea.
Let's also talk about your family history. Haemophilia is genetic, as you know. Are there others in your family who have it?
Yes, my uncle on my mother's side had it. My mom's a carrier, so there's a history there.
Understood. Have you considered genetic counseling? It's especially helpful if you're planning to start or expand your family as it provides insight into the likelihood of passing haemophilia on to your children.
My wife and I are actually considering having kids, so that's something we'd like to learn more about.
That's great. Genetic counseling can help you understand your options, such as prenatal testing or pre-implantation genetic diagnosis if you're considering in vitro fertilization.
I'll discuss that with my wife. We definitely want to be well informed before moving forward.
Absolutely. It's all about giving you the tools to make the best decisions for your family. One last thing, do you have any concerns about traveling or emergencies?
Not really, though I've heard it's a good idea to carry something like a medical ID.
That's correct. Wearing a medical ID bracelet or carrying an emergency card can be life-saving in case of an accident. Additionally, make sure to travel with enough factor 8 and know the locations of nearby hospitals in case of an emergency.
Got it. I'll look into a medical ID as well.
Excellent. Before we wrap up, do you have any other questions or concerns?
Not at the moment, but this has been really helpful.
I'm glad to hear that. We'll set up a follow-up appointment in 3 months to review everything, and in the meantime, don't hesitate to reach out if anything comes up.
Thank you, Doctor.
You're welcome, Mr. Romario.
Extract 2, questions 13 to 24. You hear a GP talking to a patient, Mr. Fields. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, come in and have a seat. You must be Mr. Fields. I understand you've come in to discuss a lump you've noticed.
Yes, that's right. I'm a bit worried about it, to be honest. It's been there for a while now, and I thought I should get it checked out.
You've done the right thing by coming in. Let's start by talking about when you first noticed the lump. Where exactly is it? And how long has it been there?
It's on my upper back, just below my shoulder blade. I think I first noticed it about 6 months ago. It didn't really bother me at first, but it feels like it's gotten bigger.
Okay, and does it cause you any pain or discomfort?
Not really. It doesn't hurt when I touch it, and I can't feel it most of the time. But I do think it's growing, and that's what worries me.
I see. Have you noticed any changes in the skin over the lump, like redness or warmth? Or has it started to feel firmer than before?
No, none of that. It's just this soft lump under the skin.
All right. And have you experienced any other symptoms like fatigue, fever, or unexplained weight loss?
No, I feel fine otherwise. It's just the lump that's concerning me.
Understood. Based on what you're describing, it sounds like it could be a lipoma. That's a benign, non-cancerous growth of fatty tissue. They're usually soft, movable under the skin, and painless, just like what you've described.
A lipoma? I've never heard of that. Is it something serious?
No, not at all. Lipomas are very common and typically harmless. They don't usually turn into anything more serious. Most people live with them without any issues. However, if they grow too large or start to cause discomfort, we can discuss options for treatment.
That's a relief to hear. But why do they happen?
That's a good question. The exact cause isn't fully understood, but they often run in families, so there's a genetic component. Sometimes they just develop for no clear reason. They're more common as we age but can occur at any time.
So what should I do about it? Do I need to have it removed?
Not necessarily. If it's not causing you any pain or affecting your movement, we can just monitor it for now. I'll measure its size today so we have a baseline, and we'll keep an eye on it over time. If it grows rapidly, starts to hurt, or causes other problems, we can discuss removal. The procedure is straightforward and involves a minor surgery to remove the lump.
All right. What if it's not a lipoma? Could it be something worse?
That's an understandable concern, but based on what you've described, it fits the characteristics of a lipoma. However, I'll perform an examination to confirm. If I notice anything unusual, such as it being firmer, irregular, or fixed to deeper tissues, I may recommend imaging tests, like an ultrasound or a biopsy to rule out other possibilities.
Okay, that makes sense.
Great. Let's take a look now. Once I examine it, I'll be able to give you more clarity. So, I've examined the lump, and it does feel like a typical lipoma. It's soft, mobile, and doesn't seem attached to anything deeper. There's nothing concerning about it at this stage.
That's a relief.
Absolutely. I'll note the size in your records, and we can review it again in 6 months or sooner if you notice any changes. In the meantime, if you ever have questions or concerns about it, don't hesitate to come back in.
Thanks, Doctor. I feel much better about it now.
You're welcome. I'm glad we could put your mind at ease. Let's keep an eye on it, and I'll see you again if needed.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 colleagues talking each other. Now read the question.
So how's the patient doing?
Mr. Alan Mitchell, a 58-year-old gentleman, had a minor heart attack last week and has been progressing well in his recovery. His blood pressure is stable at 130/80, and his heart rate is regular at 72 beats per minute. He's tolerating his new medications, including aspirin and beta blockers, without any side effects. He's been engaging in light physical activity, which is encouraged. His outpatient cardiac rehabilitation sessions are scheduled to start next Monday. I've discussed some lifestyle changes with him, including a low-sodium diet and daily walks. Before discharge tomorrow, he'll need a prescription for his new medication, a referral for cardiac rehab follow-up, and an information booklet about managing his condition. Can you ensure the referral is sorted, please?
Now look at question 26. You hear a nurse discussing AI integration in healthcare with a colleague during a professional development session. Now read the question.
As to potential complications before they occur. Diagnostic algorithms are also aiding in the identification of conditions like sepsis or arrhythmias much earlier than traditional methods. These tools not only save time but also improve accuracy in treatment planning.
That's fascinating. But aren't there concerns about relying too much on AI?
Absolutely, and that's a key point. Ethical considerations are significant. We must ensure transparency in how algorithms make decisions and avoid biases that could negatively impact patient care. It's also essential to maintain a balance between human judgment and AI recommendations. At the end of the day, AI is a tool to assist us, not replace us.
Now look at question 27. You hear a surgeon talking to a patient about a unique eye surgery. Now read the question.
Good morning, Mr. Smith. Have a seat. My name's Dr. Lena, and I'll be explaining the procedure we'll be performing to help restore your vision.
Thanks, Doctor. I've been really nervous about this. It all sounds so unusual.
I understand. This is called an osteoodontokeratoprosthesis. It's quite rare, but it's specifically designed for cases like yours, where traditional corneal transplants aren't possible.
Is it true you'll be using my tooth for this?
That's right. We'll shape one of your teeth into a small optical cylinder. This will then be implanted into your eye to serve as a new, artificial cornea.
It might sound a bit surprising, but it's a proven method for cases of severe corneal damage.
I see. What kind of results can I expect?
Many patients experience significant improvement in their vision. Of course, we'll monitor your progress closely after the surgery to ensure everything heals properly.
That's reassuring. Thank you.
Now look at question 28. You hear a GP consulting a dermatologist regarding a patient with a suspicious skin lesion. Now read the question. Thank you for taking my call. I wanted to discuss a patient I recently saw in my clinic.
Of course. What seems to be the issue?
It's about Mrs. Turner, a 62-year-old woman. She came in with a pigmented lesion on her left forearm. It's irregularly shaped, slightly raised, and has grown in size over the past 3 months.
That does sound concerning. Was there anything notable in her history?
No family history of skin cancer or similar conditions. She mentioned frequent sun exposure during her youth, but no severe sunburns that she can recall.
Did you notice any additional signs when you examined her?
Yes, there was asymmetry in the lesion, uneven pigmentation, and a blurred border. Given these findings, I'm wondering if we should proceed with a biopsy.
Yes, I definitely recommend a biopsy based on those characteristics. The growth pattern and irregular features raise a strong suspicion for malignancy, so a biopsy would be prudent to rule out melanoma.
Now look at question 29. You hear an intern's concern. Now read the question.
I noticed that Mrs. Collins has been showing signs of severe fatigue and muscle weakness. I know that providing proper nutritional support is essential for malnourished patients, but...
You're absolutely right. Proper nutrition plays a critical role in recovery by improving energy levels, boosting immunity, and promoting tissue repair. The dietitian has been working on a meal plan to address her deficiencies, but Mrs. Collins has been struggling to consume solid foods due to a lack of appetite. For now, I've recommended the use of high-calorie and protein-rich supplements in liquid form. These supplements are easier for her to consume and will help improve her nutritional status until she can transition to regular meals. It is crucial to address her malnutrition promptly to avoid complications such as further muscle loss and delayed healing.
Now look at question 30. You hear a planning for flu vaccination drive. Now read the question.
The upcoming flu vaccination drive?
Well, we've made good progress with the outreach. The response has been positive, and we've already had many people sign up for appointments. But I'm having a bit of trouble securing enough vaccine doses to match the demand, considering the importance of ensuring we have sufficient stock to vaccinate everyone who signs up. I really want to make sure we're fully prepared. Have you got any contacts or suggestions for expediting vaccine supplies?
Yes, absolutely. That's a crucial point. We need to make sure we don't run short. I'll check with some of my colleagues in procurement and see if we can source additional doses or fast-track deliveries.
Great, thanks. I really appreciate that.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview about leadership and advocacy in healthcare. You now have 90 seconds to read questions.
Hello everyone. Today I am joined by Dr. Maria Hall, a renowned occupational therapist and policy advisor, who has dedicated her career to leadership and advocacy in healthcare. Thank you for being here today, Dr. Hall.
Thank you, James. I'm excited to discuss a topic that's becoming increasingly relevant in healthcare today: how leadership and advocacy play a vital role in shaping better practices and outcomes.
That sounds fascinating. Could you start by explaining why leadership and advocacy have become so important for healthcare professionals?
Certainly. Healthcare is a rapidly changing field, influenced by technology, policy shifts, and population needs. For occupational therapists and other professionals, it's no longer enough to focus solely on individual client care. We're realizing that our problem-solving skills and holistic thinking can have a broader impact. By stepping into leadership roles and advocating at a systems level, we can address challenges like inequitable access to services, outdated policies, and workforce shortages.
That's very insightful. Could you give an example of how occupational therapists have been able to lead or advocate effectively in healthcare?
Of course. One example is the work being done around mental health awareness. Occupational therapists have used their expertise in understanding daily activities and routines to influence policy. By collaborating with government bodies, they've been instrumental in shaping programs that integrate mental health services into community settings. This not only improves accessibility, but also reduces the stigma around seeking help.
That's a great example. What specific skills do you think healthcare professionals need to develop to be effective leaders and advocates?
Key skills include communication, strategic thinking, and collaboration. Professionals need to articulate their vision clearly, think long-term, and build partnerships across different sectors. Importantly, they also need a strong understanding of policy and how to navigate complex healthcare systems. For occupational therapists, their ability to look at the big picture while focusing on individual needs makes them particularly well suited for leadership roles. How does the College of Occupational Therapists support professionals in developing these skills? The college plays a pivotal role by offering specialized training and mentorship programs. For example, they've launched a leadership development initiative that includes workshops on advocacy, public speaking, and policy engagement. They also encourage therapists to participate in professional networks, where they can learn from peers and experienced leaders.
How do you think advocacy and leadership ultimately impact healthcare systems?
Advocacy and leadership drive systemic change. When professionals advocate for better practices, they contribute to policies that improve patient outcomes, enhance workforce well-being, and ensure resource efficiency. For instance, advocating for the inclusion of occupational therapy in primary care has shown to reduce hospital readmissions and improve patients' quality of life. It's about creating sustainable healthcare systems that serve everyone effectively.
Finally, what advice would you give to professionals who want to start advocating or taking on leadership roles?
Start small but think big. Begin by identifying an issue you're passionate about, whether it's improving access to care or promoting a specific therapy approach. Get involved in your professional association, attend conferences, and network with like-minded individuals. Building credibility through continuous professional development and staying informed about current trends is crucial. Remember, every small step you take contributes to meaningful change.
That's excellent advice. Thank you, Dr. Hall, for sharing your insights.
Thank you, James. It's been a pleasure.
Extract 2. Questions 37 to 42. You hear a presentation by Dr. Rio George discussing artificial intelligence in radiology. Now, read the questions. You now have 90 seconds to read questions.
Good afternoon, everyone. My name is Dr. Rio George, and today I'll be discussing a topic shaping the future of healthcare: artificial intelligence in radiology. In recent years, the integration of AI into radiology has revolutionized our approach to imaging, diagnosis, and patient care. AI is no longer just a buzzword. It has become an indispensable tool for radiologists and the broader healthcare system. Let's begin with the core of this transformation: efficiency. Radiology has always been a high-pressure specialty due to the sheer volume of images we handle daily. AI is helping us by automating routine tasks, such as image sorting and preliminary analysis, which allows radiologists to focus on more complex cases. For example, an AI algorithm can now flag potentially cancerous lesions in mammograms, significantly reducing the workload for human reviewers and improving detection rates. Another exciting aspect is AI's role in enhancing diagnostic accuracy. Traditional imaging techniques depend heavily on the expertise of radiologists. While our training and experience allow us to interpret images effectively, there's always room for error. AI systems trained on vast datasets can identify patterns and subtle anomalies that may not be immediately apparent to the human eye. For instance, AI has proven especially valuable in detecting early signs of diseases like lung cancer and Alzheimer's. AI also promises to transform imaging workflows. Take MRI scans, for example. These scans can be time-consuming, taking anywhere from 30 minutes to over an hour, which limits throughput and patient satisfaction. AI algorithms are now capable of reconstructing high-quality images from significantly less raw data, reducing scan times and enabling faster diagnoses. The implications for patient care are immense, particularly in emergency settings where every second counts. One of the most significant shifts is the role radiologists play in patient care. As AI takes over repetitive and labor-intensive tasks, radiologists are increasingly stepping into more collaborative and patient-facing roles. We're becoming key members of multidisciplinary teams, guiding clinicians on imaging strategies and communicating results directly to patients. This shift not only humanizes our profession, but also enhances patient satisfaction and trust. Let's not overlook the challenges. The rise of AI in radiology has sparked concerns about job security among radiologists. Will AI replace us? The answer, I firmly believe, is no. Instead, AI is redefining what it means to be a radiologist. By automating mundane tasks, it frees us to focus on what we do best, making clinical decisions and interacting with patients. In fact, radiologists who embrace AI will likely find their roles expanding, not diminishing. Lastly, we must consider the ethical implications. AI systems are only as good as the data they're trained on. If the training data is biased, the AI's outputs will also be biased. For example, an AI system trained primarily on images from one demographic may struggle to perform accurately across diverse patient populations. Ensuring equity in AI applications is a challenge we must address to harness its full potential responsibly. In conclusion, artificial intelligence is not here to replace radiologists, but to empower us. By enhancing efficiency, accuracy, and patient engagement, AI is transforming radiology into a more dynamic and impactful specialty. But as with any powerful tool, it's up to us to use it wisely, ensuring it benefits all patients equitably. Thank you, and I look forward to your questions.
That is the end of Part C. You now have 2 minutes to check your answers.